This week, we'll be discussing several topics, starting off with the impact of technology on health and behavior. Information technology has been on the rise and have made much advancements over the past several years. These improvements in technology have allowed for patients to be more engaged in the healthcare process and allow people to better monitor their own health behaviors for better understanding and for making changes to their lifestyle. One such technology was made by UCI medical engineers who developed a wearable respiration monitor. This technology uses sensors to measure breath rate and volume continuously and is both inexpensive and disposable. This technology works by using two sensors placed between the 9th and 10th ribs and another one on the abdomen. To place the sensors in these positions, UCI bioengineers created a banded-like device by using thin sheets of plastic which were able to adhere to patients. This new technology can help monitor children with asthma, cystic fibrosis, and other chronic lung health conditions. For example, in this case of asthma, this technology could help forewarn wearers of an oncoming attack. This new stretch sensor allows wearers to go around their daily life while having vital information on the health of their lungs be collected at the same time. The information collected could then be transferred via Bluetooth and displayed on a smartphone app. Prior to this technological advancement, patients had to be hooked up to many wires just to monitor their respiration rate, which were limited to just a snapshot of time. This new technology allows for patients to be monitored during their entire day, which means that there is less chance where vital information is missed. Although there might be a slight learning curve for using new technology for both patients and doctors, I personally think that these improvements in technology will help patients who suffer with health conditions live better lives in the future by motivating these patients to be more engaged in the healthcare process, which can motivate them to make healthy behavioral changes for the better.
Hi, this is Marina, and I'll be discussing the impact of information technology on patient engagement. Well, there are several new technologies coming onto the scene that will help providers engage patients in their healthcare, and providers now need these technologies because their patients' panels are becoming so large. The most effective force coming into healthcare IT today is social media, the close, private, collaborative care environment that surrounded the patient with digital conversation in their entire care team, talking about their intervention, their current disease status, the risks, factors of their lifestyles, the importance of staying on medications or staying with provider intervention. Those kinds of conversations are literally impossible today in any other way, but this private, secure social network will make that possible. Also, mobile devices have a very strong effect in healthcare today. Beyond what we can imagine through a mobile device replacing a patient portal, is the mobile device becoming the patient portal and really the interface between sensors that are on the patient or worn by the patient and then passively collecting the data, uploading it to the provider's electronic health record. In conclusion, many new technologies coming on the scene today will actually drive up patient engagement because the patient won't need to actually self-enter data. The data will be automatically collected for them.
Hi, Danny here. One thing to take into account is the usability of information technology. The high impact of information technology is due in part to the usability and accessibility of information technology. Usability is the ease of use and learnability of a tool, in this case, the information technology in question. Things such as voice commands or different languages make tools more accessible for a wider range of people. Just better ease of access, in general, helps aid this. This in turn will cause a higher impact on patient engagement. There has only been little research done regarding the usability of information technology. As in the research done, only 33.5% of studies has been assessed for usability. Health technology should be as user-friendly as possible, intuitive, and efficient to learn. Usability should be further studied as it can be a good contributor to the impact of information technology. Studies could incentivize improvements upon usability. Personally, I highly value usability. An easy-to-read and user-friendly interface are imperative for using any kind of health application. Struggling to learn new technology will always be a recurring issue, and providing an easy-to-use and learn program will be great, especially for those who are health-related.
I'm Gabrielle. So we've heavily discussed the impact we've seen information technology have on health and behavior, and our ability to further develop it as a tool for health maintenance hinges on fostering our understanding on how well it works. The review that we looked at mentioned that they found no consensus on how data should be collected and measured. And the issue is, if data is collected differently, then the results represent themselves differently. Take the concern back to our previous discussion in this video and in our lecture. How would you measure the impact of social media on health outcomes? Because there are so many ways. You can trace how many times a keyword has been tweeted, you can trace how many times a keyword has been said in a certain area, and you could even decide how long research would need to wait to collect follow-up assessments. And concern also is underrepresentation of individuals influenced by social media, because some people might be more vocal about their effect online, and it could skew results because some people wouldn't be as vocal otherwise. This is overinflate data, and measuring the impact of social media can't be as empirical as a blood test or an x-ray, so we're going to have to need a common agreement on how to do this. This is an important consideration when moving forward measuring IT's impact on health outcomes.